We start our class on topic of decision making about the patient. Fourth point is that help the patient evaluate the option based on the goal and concern. So we help the patient and evaluate the option based on their goal and concern. What are our goals and objectives and concerns? Patient may not be comfortable using raising their personal goals and concerns for treatment. By actively inquiring, you are giving them permission to speak about what is important to them. Once you have elicited this information, you can help them look at their options based on their preferences. This is what the patient is giving preference to. The alternative you have provided options for the treatment. So help the patient to evaluate options based on their goals and preferences. Simple language, just as people are different, no one decision is right for everyone. As you think about your option, what's important to you? Means you have to say, you have to use this language with the patient. Or people have different goals and concerns. As you think about your options, what's important to you? For example, some people, while others. Fifth point is facilitate deliberation and decision making. Simple language. Considering what we discuss, do you have a preference about the direction we take? You have time to think things about over. Do, do you want to think about the decision with anyone else, someone who might be affected by the decision, someone who might help you starting things out? Means you can take help from the family, friends, and others to decide what could you take this treatment or not. Is there any more information you need? What what is the hardest? What is the hardest part about deciding? From what I hear you say, here's what I suggest. How does that sound to you? So this is the way how to communicate with your patient, right? This is sample language, means communication language with the patient to understand him the alternative options you have provided for the treatment. Patient may not be ready to make a decision immediately, probing for what else they need to know or do before they make the decision can be helpful. If they are ready, if they are ready to decide, you can help facilitate final decision. The sixth step is assist with implementation. Close the conversation by laying out the next step for the patient. The process by which we utilize our patient data, the patient individual needs and clinical judgment to formulate the most appropriate treatment strategies to achieve the desired outcome. Means we have to go through a process for our decision for the patient to select medicine or drug. And for that, you have to understand the clinical need of the individual patient. And after that, you have to formulate appropriate treatment strategies to achieve the desired outcome. For example, a patient is suffering from hypertension. You have to understand the need of a patient, clinical judgment. What type of medication you are going to give him, beta blocker, calcium channel blocker, diuretic, vasodilators, or some nutritional medicines. So we have to understand that what type of support and treatment we have to provide to the patient. Evaluation gathering subjects data from the patient, family, and facility staff. Please get the information about the patient from the patient itself, from his family, and your own staff who is taking care of the patient. Perceive patient and problem goals for treatment. What does the patient, family, facility staff perceive as the problem or functional limitation? Means you have to take out the words from the patient also, how they feel about this problem. And what are the functional limitations? Maybe patient financially cannot afford it. Maybe patient is not able to swallow the tablet. Maybe the patient is afraid of taking any injection. So you have to find out what would the patient, family, facility staff want to accomplish from the patients participating in therapy. If injury or falls, what are the circumstances surrounding the injury? Prior level of the function, what was the patient's level of function prior to the injury or exacerbation of the condition? If the patient is unable to provide, ask the patient staff or family responsible party. Evaluation subjective data anticipate discharge plan when patient will go from your hospital to home. What medicines you are giving along with the patient for further treatment or follow. What is the discharge plan for the patient? If returning to a less structured environment, will the patient be expected to be independent or will assistance be available? It depends. Feedback from the facility staff. If the patient is unable to provide subjective data, what feedback can the facility offer relating to the patient? Current functional limitation or other related information. Evaluating objective data, also gathering the objective data. Past medical history is very important. What are the past medical conditions or comorbidities that exist along that may influence the course of the treatment? Means in with one disease, another disease is also existing in the same patient. That is, the patient has a colostomy bag. His colon has been operated because of the cancer or something, and a bag is hanged outside. So fecal material will be stored in that bag. Residence is visually impaired and has deficit and impairment with motility. Prior to therapy, intervention and results were the result of the prior therapy generally. Did barrier exist that impacted treatment? If the patient received treatment for the same condition, what element and changes that required skilled intervention with PPOT or SLP service now? Test measurement. Does the objective data match the clinical presentation? Which test measurement should be collected based on the subjective data and on observation? What standard testing can be utilized? Tenacity work for balance, Purdue peg both for fine motor dexterity, Western aphasia for comprehension and speech. These are all the treatment given at certain diseases. Process by which the clinician utilize information gathering, including the evaluation to determine best course of clinical findings, extent of loss of function. Social consideration is also very, very important. Home environment, family, involvement, participation in activities, financial condition of the patient and family. This is very important. Establishing goal, what will be the optimal level of improvement for the patient based on reason for referral, why you sending patient to other hospital, personal goal for therapy, motivational level of the doctor and the patient both, response participation level in prior therapy, prior level of the function, severity of functional limitation and discharge point. Establish goal, what are the expected outcome, that means prognosis is good or bad. How can these be documented in objectives, measurable and functional terms? Creating a treatment plan, what procedures, modalities should be used that are consistent with the treating the patient's diagnosis and symptomatology. Self-care dysfunctions, treatment of swallowing dysfunction and or oral function, speech, language, voice communication. What is determining the frequency and duration? What is the appropriate time frame that will be required based on in the individual needs? Does the condition require intensive treatment? Is the patient health status stable to tolerate the recommended intensity? Should the intensity be reduced as the patient gains independence? These all things are very important in the evaluation and clinical judgment of your treatment plan. Clinical decision making, a comprehensive, well-written evaluation services as a cornerstone for future clinical reasoning and decision making. Treatment progression, how do we know when to progress the patient within their established treatment plan, that is, next goal or skill activity, patient response to treatment, musculoskeletal systems, is there any good effect or bad effect? Response to the treatment should be a good effect. Cardiovascular system has been improved or not, respiratory system is improved, gastrointestinal system, all systems they have to evaluate clinically and see the treatment progression. Patient's ability to perform activity utilizing safe technique in feeding, swallowing, etc. Patient ability to demonstrate functional application of skill activities. Patient ability to increase consistency of performing functional activities tasks. As the patient assessment, as the patient makes progress towards goal, assessment should occur frequently and be an ongoing process to ensure that treatment strategies are appropriate for the patient plan of care. Evaluation recertification, at least 30 days common. Re-evaluation and recertification should occur for every patient regardless of pair or source. Support the medical necessity for continuance, advance and adjust the patient goal. Describe the treatment plan for modified frequency duration can occur. New clinical findings or failure to respond to therapy intervention less than 30 days. So after that, clinical decision making, minimal progress. What this question can we ask ourselves if the patient is making minimal to no progress towards goal? Time of day of the treatment appropriate, medication issues, goal to aggressions, patient instruction to complex, treatment technique to aggressive for patients, condition goes to aggressive or to advanced. These are all things we have to see. What changes can be made to the treatment approach to improve the patient progress? alter the time of the treatment in the day, increase the rest break, split treatment, reduce frequency. These are all measures you have to take for the clinical decision making. So this is about the decision making for the patient in a clinical, how to evaluate it, how to keep eye on the progression of the patient treatment, how improvements are taking place in different systems of the body after the treatment. If there is nothing happen with the treatment or minimal progress, is there what you have to do, what actions you have to take. This is all nowadays a duty of a pharmacist. If you need, then you can change the treatment approach, provide different treatment strategies to accommodate the patient's needs, revise goals. You can change the goals, revise the goals, improve the goals, have a different therapist in the same discipline treat the patient. Means if he's a pulmonologist, you can change the pulmonologist. If he's a cardiologist, you can change the patient cardiologist. Means you can change the staff, you can change the doctor, you can change even the pharmacist. Conduct your review or team conference to discuss. So these are very, very important. Refusal, if the patient refuses over several days, the therapy program should be put on hold until the patient is willing to attend performance of the functional activity, and investigation with the nursing staff should occur to determine cause of refusal. Discharge, do we know when to discharge our patient? This is a very important question. Achieve maximum benefit from the skilled intervention. Progress towards the goal has plateau, highest point. Determine factors of the plateau, why this achievement we have achieved. Changes in the medical condition, physical limitation, request for self-discharge, when you can discharge the patient. Physician discharge order based on the physician examination, discharge to another facility, or patient expired. These are the conditions in which we discharge the patient. So this is all about today, and we will discuss more later on. Thank you very much.